Oral cancer is any abnormal growth or abnormal proliferation of tissue inside the oral cavity. This can be the reason of mutations in the genetic structure of your cells, where instead of the growth stopping and normal cell death occurring, the growth goes on unregulated, and therefore you get a proliferative or a cancerous lesion which keeps on growing without any check. So oral cancer can happen or occur on any of the subsets of the oral cavity structure. For example, the cheeks, the tongue, on the jaw, on the lips, on the palate, tonsil. All of the areas of the oral cavity and throat can develop cancerous lesions. So typically oral cancer symptoms are any ulcer within the oral cavity on the tongue or the cheeks which is not healing, anything which has been persistent for more than 15 days or which is growing in size should be considered as an abnormal ulcer. You can have lesions which are bleeding to touch, lesions which have developed a yellowish color over it. White patches over the tongue or the cheek can also be cancerous. And you can have swelling, abnormal swelling within the oral cavity, which could be related to an oral cancer. So oral cancers are one of the few cancers which have a definite cause. Most often, these cancers are secondary to history of consumption of tobacco, either in the oral form, that is like supari, betel nut, kharra, etc., or inhaled form, that is in the form of smoking. Alcohol per se does not have role in oral cancers, but it has a synergistic effect along with tobacco. So any person who is already taking tobacco and then also has a history of alcohol intake, the chances of developing an oral cancer will increase. So as I mentioned previously, if you have any lesion, a white patch or an ulcer or a swelling within your oral cavity, which has been present more than 10 to 15 days and or which has been increasing in size, that should be considered as a suspicious lesion, and you should go to a ENT surgeon or a head and neck cancer surgeon for an examination, upon which the surgeon, if he finds that lesion to be suspicious, will run some tests in the form of a biopsy or a CT scan and will be able to diagnose whether this lesion is cancerous or not. More often than not, every oral cancer can be treated surgically. This is one subset where treatment in the form of chemotherapy or radiotherapy is not effective. So unless a cancer has really grown and it is in a very advanced stage where surgery cannot be done, other than that, every lesion is effectively treated with surgery. So oral cancers are, as you mentioned, one of the commonest cancers in India, and we hold the notorious distinction of being the oral cancer capital of the world. And again, as I mentioned, this is because a large number of our population, especially in central India and in the rural parts of central India, are in the habit of consuming tobacco. So this, as I mentioned, is one of the few cancers which has a definite cause. So if tobacco consumption is avoided or stopped, that is one way where you can effectively combat these cancers. A very, very small subset of oropharyngeal cancers, that is cancers between the oral cavity and the throat, a very small subset of those can be caused by human papilloma virus, the HPV virus. And so HPV vaccination, which has now become quite routine in our country, is effective in preventing those cancers.